Well, hello and welcome to today's session. Don't let Medicare or Social Security sneak up on you. I'm April Pope, certified financial planner and personal CFO. So today we're talking about two major government programs that can often feel confusing and overwhelming, but they are critical to your retirement strategy, so we want to make sure we understand them. We also want to make sure you don't leave money on the table or miss any critical deadlines. All right? So when it comes to Medicare, I feel like most people think, or not most, maybe a lot of people think it's something that just like automatically starts at 65. But it's not exactly like that. So when and how you enroll can actually have a big impact on your overall retirement plan. Medicare decisions really, they're just not about health care. They affect your income, your taxes, and even what you'll pay for coverage in the future. So if you enroll too early or too late, that can lead to penalties or higher premiums or gaps in your coverage. And your income in retirement can affect what you pay each month for those premiums through something called IRMA, which we'll get into a little bit later. So before you sign up, it's important to understand how Medicare fits into the bigger picture of your retirement plan. And that's what we're really going to unpack together today. All right. So Social Security is one of the most important retirement income sources you'll have. Of course, it's not the only one, and it never was designed to be the only one. It's only supposed to supplement maybe about a third of what you need to live on in retirement. But deciding when to start it isn't just about age, it's really about a strategy. So taking benefits too early could reduce your lifetime income, while waiting can significantly increase it. But those decisions also need to be coordinated with other pieces of your financial life, like maybe you have a pension or a 401k or a 403b or some IRA or Roth IRA, or maybe your spouse has some benefits. And it also depends on your tax situation. So, for example, starting Social Security while you're still working, because some people still work until their 70s or 80s. So you might be like, hey, I want to start mine at 63, but I'm still working. Well, that might cause part of your benefit to be taxed or withheld. So, on the other hand, if you delay it, that could help reduce your taxable income later or boost your survivor benefit for your spouse. So, the key takeaway here is don't look at Social Security in isolation. It's just one piece of this whole, let's call it our retirement puzzle, if you will. It's one piece. So, now let's look at Medicare basics and enrollment. So, the basics of Medicare and how the enrollment works is when you become eligible for Medicare is when you hit the age 65. But your enrollment window is very specific and very interesting. It's actually a 7-month window. So you have the 3 months before you turn 65, the month in which you turn 65, and then 3 months after you turn 65. So that's the total of a 7-month enrollment period they give you. If you miss that window, you could face some penalties or some delays in getting coverage, and you really just don't want to go into that. So, there's also different parts of Medicare, and you could spend hours, weeks, months, maybe years learning about how the Medicare system works. I mean, there's a lot. But for today's purposes, all we're going to talk about is the basic parts. Part A is for hospital coverage. Part B is that's for like your doctor's visits and your outpatient care and things like that. And Part D for prescriptions or drugs. That's how you can kind of remember D. So some people also have additional coverage, and if you are retired or have Medicare, you're probably getting phone calls all the time, or your friends are telling you about what they have. They have Medicare Advantage, Medigap, there's all kinds of stuff. It can be overwhelming, but the key point is know that window. Don't miss that window. Don't miss your window for when it's time to enroll. Understand your coverage options and make sure your enrollment timing aligns with your retirement plan and your health needs, right? Okay, so coordination and timing and IRMA. Let's talk about IRMA. So this is where it really gets interesting and everything comes together. So Medicare and Social Security, they don't exist in separate worlds. Your choices for one can directly impact the other. So for instance, your Medicare premiums, I don't know if you know this, but they're based on your income from 2 years ago. So this is where that IRMA adjustment comes in that we talked about earlier. IRMA stands for Income Related Monthly Adjustment Amount. Isn't that fun? And it's really just an additional charge that's added to the Medicare Part B and D premiums. And it's for individuals whose incomes go over a certain threshold. And you can look this up online and find it, specifically what those thresholds are. But if you're still working, or maybe doing some large Roth conversions, or you have some capital gains that you're paying, or maybe receiving some deferred income, deferred compensation, any of that income can trigger IRMA and raise your Medicare cost for a year or two. So on the flip side, smart timing, like retiring mid-year or delaying income into a later year, can help minimize or even avoid those extra costs. So coordinating your Social Security start date, Medicare enrollment, and the income sources can help you manage taxes. It can help you control healthcare costs and protect your retirement income over time. Keep that in mind. All right, we talked about a lot. So as we wrap up, here's the big picture I want you to take away. First is timing. The age you can claim Social Security doesn't just affect your monthly benefits, it affects your lifetime income and sometimes even your spouse's. And what do I mean by that? If your spouse is going to end up, when one of you passes and the other one will take the larger check that's left, if you had waited a little bit and had a bigger check, your spouse might have a bigger check when they have to take a spousal benefit. So taking the time to plan when to start can add up to thousands of dollars over your retirement years. And what I mean by that is, if you look at that number, if you print your Social Security statement out and see what your monthly amount is at 62, and then you compare that to 70, it could be hundreds or thousands of dollars more per month. And if you're fortunate to live long, like my grandma who just turned 99 this year, you might have 40 some years to collect the Social Security check. So you want to make sure you're getting the most. 40 years of a reduced benefit is a lot of money you're leaving on the table. And remember, this comes from your paycheck. If you look at your pay stub, you're putting money into there. This is money that you have been putting in. So you want to make sure you take advantage of that. Medicare isn't just as simple as flipping on the switch at 65. There's windows, there's exceptions, there's special rules. And missing those deadlines, like I said, can mean penalties or gaps in coverage that can last for years. So finally, coordination. These decisions shouldn't be made in isolation. Social Security, Medicare, taxes, and all the income that you have are all intertwined. So what you do in one area can have a ripple effect on the others. So that's why it's so important to look at your entire financial picture before you make any moves or make any decisions. And when you coordinate these pieces, Social Security, Medicare, with your whole broader retirement plan, it helps you make informed decisions that are going to support your health, income, and your peace of mind, really, in retirement. And isn't that what planning is all about? So now that you understand how timing and deadlines and coordination all fit together, the next question is, what do I do with all this information? So, I always give you one simple step you can do right away so that you can stay organized. And that next step is going to be to create a timeline for when you'll file each of these, and you want to review it annually. So just literally on a piece of paper, write down 2025, 2026, write out some years until you're gonna be 65. And if you have a long time for there, maybe go in 5-year increments. But anyway, write those down and then see when you're thinking about taking Social Security, just kind of map it out. Like, I'm thinking I'll take Social Security here. My pension's going to kick in here. I'm probably going to use some of my retirement accounts here. I have rental income from real estate, so I'll probably do, live on that. Whatever it is, put those down as when your timeline for when you're thinking of taking those. And then just make it a habit to review it each year with your trusted advisor, someone who can help you coordinate this income, these taxes, your healthcare coverage as your situation evolves. So as financial planners, this is what we do. We need to look at your whole situation. So please make sure you don't just go find a financial planner or an advisor and you're like, I just need advice on when I should take my Social Security. Well, they can't tell you unless they know everything about the rest of the parts of your financial life. So you want to make sure they see the whole picture so that they can guide you in the right way. So, like I said, retirement planning isn't one and done. Your life, your health, even the laws change. So keeping that timeline updated is going to help you ensure that you're always in control and making proactive decisions. That's your one thing. I always give bonus homework for those of us that like to do a little bit more. You also could go and print your Social Security statement and start looking at those numbers between 62 and 65 and 67. And if you really want to see how much you're losing, assume you're going to be in retirement for 40 years. take that monthly difference, it's a $500 difference, multiply that by 12, that's how much less you're going to get per year, and multiply that by 40, that's how much less you're going to get out of the system. So that's when you really can see, man, maybe I really don't need to take it early. Maybe I should wait a little bit, but don't wait past 70. Never wait past 70. It doesn't grow after that, so you're not doing any good. Okay, so I know it was a lot to take in, and everyone's situation looks a little different, so I'm going to open it up for questions. I do have questions in the chat. So let me know, add them to the Q&A if you have questions about, again, like I said, I can't tell you exactly when you would take it, but if you have questions about what we talked about today, definitions, the timeline, anything like that, feel free to keep adding them. I do have a few here that I'll go ahead and get started with. So the first question is, when I'm applying for Social Security, how do I decide when to do it if I am going to use an ex-spouse's? Okay. Ooh, this is a great question. We are jumping right in, aren't we? Great question. So let's talk about that ex-spouse benefit and what that means. So as long as you were married for 10 years to someone, then you're eligible to claim on their Social Security benefit, if you will. Important part here is it does not affect your ex-spouse. They don't even need to know. You don't need to tell them or anything. You go down to Social Security and claim your benefit. It will not affect their benefit. So the way that it works is Social Security they have to give you what's going to be in your best interest. So they'll look at what you would get on your own record and then look at half of what you would get, because that's how they look at it, half of what you would get from your spouse's record, your ex-spouse's record, and see which one's bigger, and you'll get the bigger check. So if for some reason, let's say your spouse, worked a lot longer or had a lot higher income, and even half of their benefit is more than your full benefit, then it would make sense to take that, and that's what they'll let you claim on. So they'll help you figure that out, which one makes the most sense. And there's different, ages of when they file. There's a lot that goes into that. So the key here is just knowing that if you were married for 10 years, you do have access to potentially I don't want to say but claim half of their benefit. And if that's better for you than it would be to take your own, then you can do that. And Social Security will help you figure that out. There's also timing and information about whether their retirement age, your retirement age. It gets a little bit tricky, but it's very clear on when you can claim it. So they will help you out there. Great question. The other question, I think it was a follow-up to this, was, do I have to bring my spouse down there with me? Ex-spouse? Absolutely not. You left them in the past, leave them in the past. So no, they do not have to come down there. They don't have to know anything. It's a law. I mean, you're not breaking the law. You're not doing anything sneaky. Think about it like this. The reason it's set up that way, let's say maybe the wife was working a nice job, and the husband decided to stay home with the kids for some years. And then when it was time to go back to work, they needed to take care of aging parents. So he never really went back to work. But they still raised a family together, had marital income, even that wife that was making all the money, it was still household income. They get divorced. They were probably thinking, we all think we're going to be married forever, and they're building their retirement accounts and all this kind of stuff. And then they get divorced. Well, he wasn't planning on that. She wasn't planning on that. Nobody goes into the marriage thinking they're going to get divorced. So when it's time for him to go claim, he's like, well, wow, I gave up 15 years of my life trying to, raise the family. We were still working, so it's only fair that you were married that time, and you can at least claim half of what their benefit would be. So that's kind of the idea. It's to protect that spouse that may not have worked as much, or maybe took care of the family or had other things to take care of, and didn't get to have a long enough working record to actually have a large enough benefit for Social Security, if that makes sense. Okay, great question. And then I see a question about what happens if we postpone past 65 up until 70. Another great question. So when you look at your retirement age, you will see something, or when you print your statement, they used to come in the mail. You notice they don't come in the mail anymore. So you have to go to ssa.gov and print them off. But when you do that, what you're going to see is your FRA. That's your full retirement age. And what your full retirement age is, that's the age of when you're going to get your full benefit. It's not going to be reduced. So if that's 66, 67, sometimes you'll see 66 and 8 months, depending on the year you were born, or the month when you were born, what your birth date is. So when you look at that full retirement age, if you decide to wait past that, or even if you wait past 65, it goes up about 8% each year. So it's just going to continue growing. And if you're working still, Social Security is based on your working record and what all your salaries were. So if you're working and you have more salary and higher salary maybe in the last few years of your job, that could actually increase your benefit as well, because it's based on, those calculations are based on your earning records. So it grows, but it grows about 8% per year up until 70, and then it doesn't grow anymore. So I don't want to hear anybody come say, I did the right thing, I waited till I was 75 to file. Heck no. Never wait past 70. Full retirement age is when you can get your full retirement without a reduced benefit. 62 is the earliest that you can get it, but it will be reduced, and it's going to be reduced for life. And 70 is the longest you want to wait. Great questions. Oh, thank you all so much for joining. This was fun. I hope you found some great information. Hopefully it was helpful and worth your time. Again, I'm April Pope, Certified Financial Planner, and I hope to see you here next week for some more great conversations and a new topic. You can find that topic online. It's on Facebook, Instagram, and LinkedIn. We have all of October's topics already out there. So I look forward to seeing you soon. Enjoy the rest of your day.